Hi guys, and welcome back to 247 Online Nurse, and thanks for staying tuned, for watching my videos and for subscription. This is your girl and Kim, your 247 Online Nurse, and today we are going to focus on family planning. In my previous video I said that today I'm going to focus on my next video. I am going to focus on each type of contraceptives at a time. How does it look like? How does it work? Its mode of administration, the advantages and the disadvantages. And today our first contraceptives that we are going to look on is called a transdermal patch, or a stick-on contraceptives, or a contraceptive patch. So what is this you're calling a contraceptive patch? It's just a shiny plaster that sticks onto the skin, and you can either stick it on your lower abdomen, on the back, on the buttocks, or the upper arm. And it works by releasing the hormones to the bloodstream via the skin. It works by prohibiting the ovaries from releasing the egg, and also thickens the cervical mucus such that the sperm cannot reach the egg to fertilize it. In that way, it is highly effective in preventing pregnancy. So, this type of contraceptives, you put one patch on any site that we've talked earlier. It's either on the back, on the lower abdomen, the buttocks, the upper arm. You stick it for 1 week, then you replace it. Then repeat that process for another 3 weeks. That is a total of 21 days. So in a month, you're only going to use 3 patches. That is a total of 21 days. Then on the 4th week, you skip it, you don't put it, such that you're giving your body a chance to for you to have your menstruation period. So after the menstruation period, you repeat the cycle each week for the next 3 weeks. Then you give yourself a break of 1 week to have your menstruation period. So it's got its benefits and it's got its disadvantages. This type of contraceptive, one, it's very effective to use it, and then doesn't require daily attention and doesn't interrupt sex, and it is easy to put on and also to put it off or to remove it. It's very easy because it's just a plaster. You can stick on, you can stick it, you can remove it. Yeah, very simple. Then obvious, because it's a hormonal type of contraceptives, obvious you'll have some mood swing, headache. You can also have some weight gain, weight loss. Then it's visible. That's another disadvantage. It's visible. It can become loose and fall off, and doesn't prevent you or protect you from getting sexually transmitted infections or diseases. Our second type of contraceptives is called lactational amenorrhea. Lactational amenorrhea is just a temporary type of contraceptive or a family planning method whereby breastfeeding itself suppresses the woman's fertility in early months after giving birth, and can be used as long as this child is less than 6 months and is breastfeeding on demand, and this woman has not yet started receiving her menstrual period. Therefore, for those women who cannot, or for those people who cannot use this type of contraceptives, is if you've already started receiving your menstrual period, don't try using this type of contraceptives. If already your baby is more than 6 months and you've already started weaning this baby, don't use that type of contraceptive. So another type of contraceptive is called contraceptive diaphragm or cervical cap. And here we are talking of a circular dome-shaped device that is made up of soft silicone that is inserted into the vagina before you have sex with somebody, and it covers the cervix such that the sperm is not in a position to reach to the womb, therefore no fertilization will take place. And this type of contraceptives can be used on demand, can be used by breastfeeding mothers, and it is hormonal free. There's no hormones here. So the mood swing, the headache, the weight gain, it's not there because it's not a hormonal type of contraceptive. And some of the disadvantages of this type of contraceptives are: one, for it to be effective, you have to use a chemical called spermicide, and spermicide slows down the movement of the sperms. And if there's no movement of the sperms, obviously there's no fertilization that is going to take place, and it's not effective for women who have given birth. The reason being, childbirth itself, it stretches the cervix and the vagina such that the cervical cap may not fit well. So this type of contraceptives is not effective for women who have given birth. And this type of contraceptives may take time, may take practice for you to know how to do it. And for initial insertion, it requires somebody to go to the hospital, to the nearest clinic, for healthcare worker to demonstrate for you how to do it, or can insert it for you for the first time. And it can cause some irritation, some allergic reactions for patients who are allergic to silicone. And on our next type of contraceptive, we are going to focus on condom. And condom is a thin latex that is worn into the vagina or on the penis. And it prevents the sperms from coming into contact with an egg, and therefore there is no fertilization that is going to take place. And some of its advantages is that it prevents somebody from getting pregnant, and also prevents you from getting sexually transmitted infections and diseases. And it is also a simple method to use, and it is also easy to use it. Condom use procedure, please check out on my previous video that I did on correct condom use and learn something about condom, how to wear it, the procedure, the process, and the steps on how to wear a condom. And next, you're going to focus on intrauterine device. In other words, many people refer it to as IUCD. And IUCD, we are talking of a tiny T-shaped plastic device that is coated with copper, and it is inserted into the uterus, and it prevents the sperms from fertilizing an egg. So it is the sperm is not in a position to reach an egg and fertilize it. So there is no pregnancy that is going to occur in a position whereby the sperm is not reaching an egg for fertilization. And this type of contraceptives, after insertion, the mode of action or its action is usually immediately, and after removal of these type of contraceptives, that is after the expiry date, or if somebody wants to conceive, it's usually immediately or promptly. And then this type of contraceptive can be used by lactating or breastfeeding mothers, and it is highly effective. And when we talk of effectivity here, we are talking of 98 to 99%. So the failure rate of this type of contraceptives is just like 2%. So if we take like 100 women using this type of contraceptives, like it's only 2 women who are going to fail on this type of or they're going to get pregnant when they on this type of contraceptive. So we're talking of 98 to 99% effectivity. And it's also a long-term type of contraceptives. You can use it for 3 years, 5 years, 10 years, and so on. So it gives you time to plan for your next child, and also give you time to heal as a mom. So, and also it's got some disadvantages. For example, if you're allergic to copper, you can't use it. And the first few months after insertion, some women usually have spotting, or they can have these period like cramps or pain after that is in the first few months or first weeks after insertion. And it can't prevent you from getting sexually transmitted infections or diseases. And who can't use this type of contraceptive? This type of contraceptives cannot be used by women who have cancer of the uterus or the cervix, or women who have got irregular bleeding of a known cause, or if you're pregnant, you can't use this type of contraceptives, or in case you've got recurrent sexually transmitted diseases or infections, you can't use this type of contraceptives. We are going to focus on an injection type of contraceptives, and here we are going to focus on Depo, which is given as an injection after every 3 months. And it works by preventing an egg from eating the sperm. And also it thickens the cervical mucus such that the sperm is not in the position to meet an egg for fertilization. And it has got some advantages in that it reduces some menstrual cramps or pain, and it lessens some menstrual flow, and in some instances you'll hear women saying that they don't receive their menstrual period for like 3 months when they are using this type of contraceptives. And it is highly effective and does not require like daily action. It's not like pill that you're going to take it like each day and you have to keep time. So it's got some disadvantages also. It does not prevent a woman from getting sexually transmitted infections or diseases, and it delays somebody's fertility after maybe expiry date, or after somebody wants to get pregnant. It delays somebody's fertility. So it can even delay your fertility even after like a period of like 3 years, an year, before your fertility now comes back. And this type of contraceptives also, because it is hormonal, it's got mood swing, weight loss, weight gain, headache, weakness, fatigue, yeah, all those things they occur when somebody is using Depo. We are going to focus on implant, which is a small rod-like, which is plastic, that is inserted on the skin of the upper arm of a female, and it acts by suppressing or preventing any production of an egg, and also thickening the cervical mucus such that the sperm is not in a position to meet an egg for ovulation. And it's a very effective type of contraceptive, and when it is removed, the fertility of a woman comes back immediately. And some of its disadvantages is that you can have an infection at the point of insertion, and cannot prevent you from getting the sexually transmitted infections or diseases. And you can have it's also expensive to insert it. You need some coins, it's an extra cost to insert it. Is a bit expensive, and you also need to visit a doctor or a nurse to insert it for you. And because it's a hormonal type of contraceptives, you will have some side effects like headache, weight gain, weight loss, breast pain. You can also have ovarian cysts when you're using this type of contraceptives. You can have mood swing, yeah, all those, because it's a hormonal type of contraceptives. This is what you get after, but it's not everybody get it. Some get it, some don't get it. So contraceptives depend with an individual, so you can have the side effect or you don't have them. Guys, for being here with me, camping here with me, listening to me. It's been a long presentation. Thank you all. If you're new here, please don't forget to like, click the notification bell, and please subscribe to my YouTube channel. And for questions, comment, please keep them coming. I am here waiting for them. That's all, and please see you on my next video. Part 3 of family planning is coming, guys. Thanks all, and bye.